Thank you, my listeners. Today I'm very much excited for I have got a good topic for you. The ladies, this topic is going to enable you to be able to take good care of your bodies whenever you're pregnant. And the men, this topic is going to enable you to be able to take good care of your women whenever they are pregnant. And you may be asking yourselves, what is our topic? The topic today is how high blood pressure, or what we commonly refer to as hypertension, affect your unborn baby. And here we are heading on to several queries. The first one, what is high blood pressure, or what is hypertension? It is simply when the blood in the arteries or the blood vessels that carry blood from the heart to the rest of the body parts is higher than normal. And this will lead you to another question. When do we say that blood pressure is normal? Normal blood pressure is usually below 120/80. We are saying that normal blood pressure should be reading between, below 120/80. Anything which is above that, we now refer to this blood to be starting to rise beyond normal. But if it is rising beyond 120/80, but it has not gone beyond 129/80, at that level we shall just refer to the blood pressure to be elevated. We are saying that an elevated blood pressure is when the blood pressure is beyond 120/80 but less than 129/80. Then we are simply now precisely on when is blood pressure high. Blood pressure becomes high and requires attention when it now rises beyond 129/80. This means anything reading like 130/80 and above, beyond 130/80, that requires very much attention and very much care, which needs you to do a lot of things for you to be able to lead this blood to come back to normal. But let's come back to our topic of the day. Does high blood pressure affect the mother alone? That's a query that some of you may be asking. And the mother here we are talking about is the mother who is carrying this unborn baby. Does high blood pressure affect the mother alone? The answer is a big no. Both of these people, the mother and the fetus, can be affected very much when the mother is suffering from a high blood pressure. Effects of the fetus when the mother is suffering from high blood pressure. One of them may be preterm birth. When we talk about preterm birth, we are talking about birth before 37 weeks. We may have low birth weight. The baby may be born with less than 5 pounds. Inadequate nutrients may not reach the baby, and even the oxygen may not reach the baby whenever it is in the womb. Even the baby at times may die, what we call fetal death. Sometimes it may lead to neonatal death. That is the death of the baby in the first 28 days, rather, not 48, the first 28 days after birth. Then, here are some questions that we may ask ourselves. What are some of these symptoms of high blood pressure during pregnancy? Your mother, you are carrying your child, you are carrying that fetus that you are having, but you may be asking yourself, am I having high blood pressure? Or what are some of the things that may happen to me so that I know if I'm having high blood pressure or my blood pressure is normal, and so on. In most cases, high blood pressure does not cause any symptoms, but it is usually realized during a heart attack, a stroke, when somebody is suffering from some kidney diseases. That's when some people realize that they are having a high blood pressure. That's why we usually refer to this disease as to this condition as a silent killer. Let's look at the pregnant women. Though we've said that in most cases HBP does not cause any symptoms, but in some of these pregnant women, some may have some certain symptoms which may lead them to a case and conclude that they are having high blood pressure, hence they go on to see a doctor or a medical practitioner. Some of these symptoms may include headaches. You may also feel dizzy. You may have some shortness in breath. There is some difficulty in breathing. They may be having some blurred vision, not being able to see clearly, focus clearly. You may feel some pulsations in the neck region, the head region. Nausea also is not an explosion. It is there. Some of them may feel nausea. Some may even have a pain in the upper stomach area. And if you look at some of these women who are having the high blood pressure during pregnancy, you may see their hands are swelling and even their face, and some of them may even have some sudden weight gain. In that case, you may be asking ourselves, what are some of the causes of high blood pressure during pregnancy? This is a difficult question which most medical practitioners and researchers have not even well established what causes HBP during pregnancy, but they just attribute some of the risk factors which may lead to this. And the risk factors which leads to HBP during pregnancy are preeclampsia, kidney diseases. We may be having thrombophilia. Thrombophilia is a condition which leads to clots in blood, diabetes, obesity, lupus. Talk of multiple pregnancy. Multiple pregnancy, we are referring to a case where the mother is carrying twins or triplets. And also in some cases, a woman who is having a first pregnancy is highly attributed to be having or to suffer from high blood pressure. What are some of the things that these pregnant women should do? The person who is suffering from high blood pressure, what are some of the things that she should do, or what are some of the treatment or the control measures of this case? The mother is recommended to rest, and the kind of resting she has to do is to lie on the left side and take weight from the babies of the major blood vessels. We are saying she is supposed to lie on the left side and take off the weight of the major blood vessels, weight of the baby from her major blood vessels. Also, the mother is supposed to reduce salt intake. In that case, she has also to take too much water, 6 to 8 glasses per day. These are some of the recommendations that are given for this pregnant woman who is suffering from HBP. What should not be forgotten is this mother should always remember to go for prenatal checkups. We recommend that the mother should have at least 2 checkups per week. In this case, the doctor may be able to check on and discover anything fishy and be corrected early enough. Thank you. Thank you for listening, my listeners. Let's meet another time on some other topic. Thank you. Thank you, my listeners. Today I'm very much excited for I have got a good topic for you. The ladies, this topic is going to enable you to be